Good day to everyone. I, Carl and Llacuna, Ilano, and Grianne Macahipay will be your reporters for today. And the topic that we'll be discussing is all about cardiovascular endurance. But first, what is cardiovascular endurance? So, cardiovascular endurance is a measure of how you can do exercises that involve your whole body at moderate to high intensity for an extended time. It refers to the capacity to exercise without feeling exhausted since your heart, lungs, and blood vessels are in good shape. Improving your cardiovascular endurance can make it easier for you to carry out your daily tasks. Since cardiovascular endurance improves our strength and stamina and make our bones stronger, we can do a lot of tasks with any deficiency. This is because when we practice ourselves to do exercises that will develop our cardio, our heart pumps more efficiently, our lungs work better, our muscle gets stronger, and our body is more able to use fat as an energy source. And these body responses will be discussed further later in the next reporter. It can lessen your risk for diseases such as diabetes, heart disease, and stroke. For this reason, again, when we're still young, we need or we must practice and involve ourselves to various exercises to avoid NGOs or non-communicable diseases later in life. You can raise your level of cardiovascular endurance by doing exercise that increase your heart and breathing rates or aerobic exercise. These exercises includes jogging, best walking, cycling, bear crawls, swimming, and many more. But before doing this, we need to determine the intensity of such exercise to avoid injuries. According to research done by experts across the globe, aerobic exercise is the most important part of physical fitness. This is because over the long term, aside from the reason that it reduces the risk of having NGOs, aerobic exercise also improves our mental health, thus, it helps us to escape depression. To achieve cardiovascular endurance, you should exercise aerobically 30 minutes per day or 3 to 7 days per week and or aim for 150 minutes per week of moderate intensity activity. This is all for my part and I hope you've learned a lot. The next reporter will be Ilano.
Hi everyone, I am Ilano Mickee from BEC 1C. The topic that I'll be discussing is also related in cardiovascular endurance. So, according to a research done by the experts across the globe, the best way to achieve cardiovascular endurance is to exercise aerobically for at least 30 minutes per day or 3 to 7 days per week. So, when we do aerobic exercise, our body will expand in different ways. It can be number one, your heart pumps more efficiently and work better. Number two, your blood volume and delivery system will improve. Number three, your resting heart rate will go lower. Number four, your heart pumps out more blood. And number five, your ligament, tendons, and bones will get stronger and your body is more able to use fat as an energy source. So, aerobic exercise is any type of cardiovascular conditioning. An example of aerobic exercise is it can be walking, jogging, cycling, swimming, and etc. And those are the activities that could help us to improve or to increase our breathing and heart rate.
Hello everyone. Hi, I am Grianne Villegas Macahipay, and my topic is about incorporating FITT principle to cardio exercise. So the FITT principle or the FIT principle can help you incorporate cardio exercise into your physical activity plan. Here are the things you can do according to the Centers of Disease Control. So first is frequency. Your long-term goal is to do cardio exercise at least 5 times per week. If you need to set up small, aim to get cardio in at least 3 times per week. If this is difficult, you can always adjust the intensity and the time so that you can achieve this frequency goal first. Research shows the frequency of physical activity is very important for reducing many heart-related risk factors, including blood pressure, stress, and blood sugar for people who have diabetes, following the second principle. So the frequency it is how often you work out during a given week. So in cardiovascular endurance, it is recommended to exercise 3 to 5 times per week. So the second one, I stands for intensity. Moderate intensity aerobic activity noticeably accelerates the heart rate and it also generally breaks sweat. According to the talk test, if you are doing a moderate intensity activity, you can usually talk but not sing during the activity. Whereas, if you are doing vigorous intensity activity, you will not be able to say more than a few words without pausing for a breath. So, intensity, it is how hard you work out. So in cardiovascular endurance, it is recommended to have 65% to 85% of maximum target heart rate. So it is labeled as light, moderate, or vigorous intensity. So the third one, T stands for time. Your cardio session should last at least 10 minutes at a time. But the longer you are able to exercise, the more calories you will burn and the more endurance you will build. Following the third principle, aim to slowly increase the duration of your physical activity over time to reach at least 30 minutes of continuous cardio. So time, it is how long you work out. So it is recommended in cardiovascular endurance to have 20 to 60 minutes time every day. So for the last one, which is type, it doesn't matter what type of physical activity you do, as long as you work up to doing it about 5 times per week. You get your heart rate up and you make it last at least 10 minutes at a time. Begin slowly and listen to your body to make sure you are tolerating it well. So type, it is what form of exercise or activity you can perform. So in cardiovascular endurance, we can do some exercise like walking, jogging, biking, running, swimming, or even cycling. So that's it. Always remember that FITT principle stands for frequency, intensity, time, and type. Thank you.